Thank you guys for joining us today. We're going to be talking about mood, specifically anxiety and depression, and how to address it naturally. If you can take a second to open up your chat, if you're just joining us, that's a great way to ask questions as they come up. That way we don't forget to address them. We have so much to cover today that we're going to take time at the end to go over those questions that are entered into the chat. So we want to make sure that you guys walk away with some really tangible information, things that are useful for you. So putting those questions in as they come up is very much welcome. So I'm Dr. Molly Force. I'm the clinical director here at Prosper Natural Health. And with me, I have Dr. Rosalie and Dr. Mary, and we're all naturopathic physicians, which means that although we're primary care physicians, we really like to treat naturally whenever possible. So we start with natural options and natural remedies and really try to understand the physiology about what's going on. And that's something that's going to be really important in our talk today, because so much of what can be supported with mood and changed with mood really can be traced back a lot of times to physiologic links and physiologic reasons. So we had this little question today that, is just a way to kind of have a little brain teaser to think about with, what percentage of the population currently has anxiety. And, especially thinking about the pandemic, that can really have influenced that number here in the US. And then what percentage has depression? And we've got some really great answers. My thought to this was definitely over 50% just from having talked to people. Dr. Rosalie just entered in our answer, and actually it's closer to that 32%. But this is really what's been diagnosed. So this means these people had to come in to a clinician and get a diagnosis. And we do see a significant increase of 10 to 15% when we look at the statistics post the onset of our COVID-19 pandemic. So that has been a real game changer for a lot of people in regards to their mood. So our goals today are going to be really looking at, number one, how do you recognize mood imbalances and how those can affect your health? We want you guys to be able to really listen to what your body is telling you. We also are going to be covering ways to evaluate mood and ways to measure and monitor mood. And then lastly, and very importantly, why many of you are here, we really want to go over some natural approaches to help you find balance in regards to mood. So we want to start just by talking about anxiety. Many of you know that feeling or that sensation of anxiety, but it's really important to take a moment and kind of define it. So this can be a mood disorder that is very much felt physically by people. So we've got these physical symptoms that can be this feeling of unease. It can also affect our heart rate and our breathing. We can get some shortness of breath with it. Sometimes people have neurologic symptoms that show up, like tingling and numbness, even feeling lightheaded. Really, it can cause feelings of irrational thoughts, even that sensation of being scared and under threat. So there are lots of different causes for anxiety, and people really describe different, what I would consider flavors of anxiety when we're working with them. It's really important to understand not only if a person is experiencing anxiety, but how it shows up in their life, when they're triggered for it, when they're at most risk for it. So these are things that I want you guys to be thinking about for yourselves personally or your loved ones personally. Whoever it is that you are really coming here and showing up today to learn about these mood disorders for, really take a moment and think about the specific ways that those imbalances show up in their lives, because it helps us when we're thinking about how to address them. With depression, a lot of us have felt that sensation too. So It's having that lower mood that affects our day-to-day ability to contribute to society or do our whatever our goals are to accomplish our goals. So this can deeply affect our motivation. It can absolutely have physical symptoms that can come into play for people. And we also have these, the mental symptoms, which can include things like brain fog and difficulty thinking through problems. Really common causes, of course, of depression can run the gamut, and we're going to talk about some of those today. We're going to take a look at stress, which can be a big impacting factor for both anxiety and depression. So something we really want to make sure you guys understand is this ability of the brain to be plastic. What that means is it's changeable. And this is a really good thing. We're designed to have a very adaptive brain. So that means that adaptation, depending on what inputs we have, those stressors that we have, can really help our body get through periods of challenges. So we have what we call this adaptive plasticity that can help us with improving our function after a stressor. A really common example of that with brain is stroke rehabilitation, where the neurons and the nerves are coming back online as we go through that rehabilitation process. There's also a plasticity that can happen, which we call maladaptive, that we don't like as much, can lead to dysfunction. And a great example of that is after a severe trauma. So in something like PTSD, we see this maladaptive plasticity. And then we can have this long-term potentiation. And why that's important is if we have a stressor that's not addressed, and the body does this very natural adaptation piece, but it leads to a dysfunction, and that continues, then there's a continuation of signaling in the brain, and the brain can learn those patterns and come back to that very quickly. So what we see in our patients are certain triggers of stress that might reawaken episodes that they've had in the past of anxiety and depression. So this is really important for us to know that these are, to some degree, learned pathways from our neurology. Now, we also can utilize this information as naturopathic physicians and say, hey, this is really powerful. This means that the brain has the ability to change. So with certain inputs, we can help change these chemical and nervous system pathways, and we can help potentiate a long-term healthy pathway that we want to really protect from relapses into some of these imbalances.
Okay, thank you, Dr. Molly. So next I'm going to talk about some of the basics of the nervous system. So neurons are the cells of the nervous system, and they provide the electrical pathway to transmit information around the body. And neurons need really specific things to function. And later in our PowerPoint, we're going to discuss how to provide the nervous system with these building blocks to function optimally. So the neurons need energy. So ATP is kind of the dollars that mitochondria, or the energy producing parts of our cells, use to put into the system and enact what we need physiologically. So for energy production, we need oxygen. We need glucose. So this is the brain's favorite food and is the easiest way to get energy into the brain. And then we need methyl donors. So methyl donors are donating a particular part of a molecule that allows for those molecules to be synthesized or produced. And those include folic acid and B12. And then we need neurotransmitters. So those are the chemical messengers between neurons. And then we need stimulation. So whether it's verbal, whether it's touch, visual, hearing. All of those are types of stimulation that allow us to produce these neurological impulses. So next I'm going to discuss the hormonal influences on mood. So as you can imagine, hormones play a large role in anxiety and depression. First, we've got female hormones, so estrogen and progesterone are the main ones we're discussing here. And our balance of estrogen and progesterone can have drastic implications for anxiety and depression. So for instance, high estrogen and low progesterone is associated with anxiety states. Whereas when progesterone is really high, you can see people become weepy and depressed. And so we're often really looking to balance these to support people with their mood. Testosterone is the main androgen, and that provides often a sense of well-being, and depression can be associated with low testosterone states. Thyroid is one of the first things we look at when someone is reporting depression or anxiety, and that's because when you're hypothyroid or your thyroid hormone is too low, this can be associated with fatigue, lack of motivation, and that is can be one biological cause of what can appear as depression. We also have hyperthyroidism, so thyroid being too high, and that can lead people to feel really anxious, really kind of hyper, and have a lot of insomnia. And then if you've been to our previous doc talks, you know, we talk about cortisol a lot. That's our main stress hormone. And so cortisol is elevated during times of high anxiety, and that sustained elevation and secretion of cortisol can lead to what's often referred to as adrenal burnout, in which you stop producing as much cortisol, and that can make you feel really tired, lacking motivation, and that can also contribute to depression long term. And then lastly, we have melatonin. That is our sleep hormone that's released naturally from our pineal gland before we go to sleep, and it allows us to get into a sleep state. And deficiency in melatonin or a lack of regulation of melatonin is often associated with anxiety and can affect our sleep patterns.
Let's dive next into these specific neurotransmitters, which Dr. Mary touched on. They're sort of the chemical signals that are released from these nerve cells, also known as neurons. And so if you look at the schematic on the right-hand side, you'll see a nice neuron there, and the little dots inside are the neurotransmitters, okay? The space underneath that nerve cell is a really important space. It's a target of a lot of antidepressant drugs, etc., because as you can tell, the neurotransmitters, those little black dots, go into this synaptic space where they're then able to bind to a receptor on another neuron and then transmit a signal. So this transmission basically can be enhanced by a whole host of different neurotransmitters, which are the excitatory neurotransmitters. Epinephrine, which is adrenaline, norepinephrine, which is a precursor, dopamine, acetylcholine, and serotonin all sort of excite the nerves in various ways, and they all have their own flavor, which we'll touch on later. The inhibitory neurotransmitter is really important to keep in mind, because when that one gets pushed out, it means that the chemical signal is attenuated. It's sort of blocked. We put the brakes on the nervous signal. So with neurotransmitters, maybe you've heard in the past that, depression can be due to, chemical imbalances in the brain, etc., which is very much part of what's going on physiologically. So if there's too much of a certain neurotransmitter, we can get certain symptoms. And if there's too little, we can get a whole host of other symptoms. There's many causes for having too many neurotransmitters. For example, medications like SSRIs that get used for depression. If we've too much of that medication, it means we've got too much serotonin and we're over medicated, and that can be problematic. Same thing with certain foods, such as ones that contain MSG or monosodium glutamate. That can lead us to pushing that GABA system of neurotransmitters a little too much.
So this idea that mood is regulated by chemicals is one that is really important, and one that's talked about a lot, I find, with patients, or they'll come in and say, like, it just feels like this mood piece it's like a chemical disruption for my body. And we want to really have you guys understand these very powerful neurotransmitters, because they really help us understand some of the flavor of our signs and symptoms. And it really helps us understand what's going on with this physiology piece. And that is empowering for understanding what can we do naturally to support the body. So the first neurotransmitter we're going to deep dive into today is serotonin. And many of you guys have heard about this hormone. It's what we consider our happy hormone. Now, the powerful little factoid here about serotonin is that about 80% of it is produced not in the brain, but in the gut. So if you guys have heard us say, or heard other people say, that the gut is the second brain, this is why, is because our GI system is responsible for making a lot of these neurotransmitters that then pass through the blood-brain barrier and affect a whole host of cells in our body. Now, this mood regulator, serotonin, is absolutely essential for the feeling of happiness, for the feeling of having drive, motivation, the feeling of feeling emotionally stable. It also, because it's produced in the gut, it has a very direct physical stimulation on the intestinal system. It helps our migrating motor complex, which helps us move our stool and our food products through our intestinal system. So it regulates to some degree how fast we digest. It can deeply affect vomiting and appetite, excess and suppression. It can also be very important for pain modulation in the body. We notice with our depressed patients that have low serotonin, their ability to feel more pain and be affected by chronic pain disorders is much higher. Serotonin also influences our body temperature, so it's going to influence to some degree how we feel in regards to our circulation and that, once again, that pain sensation. And serotonin is a it helps with our sleep, and then it is a product directly of melatonin. So when we look at how the chemicals are broken down in our body, we have to go from melatonin to serotonin. So a big red flag for us, if we have somebody coming in and saying, I'm not happy, I'm not satisfied, I'm really depressed, is what's going on with sleep? Do we have proper amounts of melatonin being produced so that we can even get to the point of producing serotonin in the body? Now, with serotonin imbalance, remember, with these chemical packets, these neurotransmitters, we have the problems if we have too much, and we have problems if we have too little. So too low of serotonin is one that we know well. It's the depressed person. It's the person that's experiencing insomnia. And you guys can see that why that would be, right? Because they're not building the melatonin to produce the serotonin. we have, these patients, once again, a lot of times we'll be talking about more pain. A lot of our fibromyalgia patients deal with lower serotonin, for example. People who have digestive disorders, migraines can be very much influenced by serotonin levels being too low. Tendency towards anger can be affected by serotonin, but we're going to learn another neurotransmitter that's even more implicated for frustration that's tied in with depression. Obsessive compulsive disorders like OCD sort of style disorders, they can be very much regulated by depression, and anxiety can be too. High levels of serotonin, too much serotonin, can feel people can feel very nervous and shy as well. We're going to go into dopamine next. So I think Dr. Mary is going to cover that one.
Thank you. So dopamine is another one of our major neurotransmitters, and this one is largely associated with pleasure. So it's released with love and chocolate. It is also associated with motivation and reward systems. So it gives us our desire to accomplish goals. Has huge implications for cognition. It modulates prolactin, which is a hormone that that promotes milk production and can also affect many of our other hormones. So it's one to consider when we're looking at hormone imbalances. And then dopamine is also largely involved in motor coordination. So we'll talk about that in the next slide with Parkinson's. It's within the etiology of Parkinson's, or the what happens with Parkinson's is you have death of the dopamine producing neurons, and that can lead to tremors that we see with Parkinson's. And it also plays a major role in mood, attention, and learning. So with low levels of dopamine, we can see depression. It's often just people who feel really grumpy and quick to anger. Many people with low dopamine levels can be easily distracted. And again, we can see those resting tremors in Parkinson's disease. That's due to a lack of motor coordination. You can also see social anxiety, low libido, and learning disorders associated with that attention deficit, and then chemical addiction. So because dopamine is so involved in that motivation and reward pathway, and addictions also work on similar pathways, if we have low levels of dopamine, we're often looking to get those dopamine hits through all kinds of addictive substances like caffeine and alcohol. And then with high levels of dopamine, we can see psychosis, increased libido, hypersocial activity, and even schizophrenia.
So those were the excitatory neurotransmitters. Now we'll sort of transition into the inhibitory neurotransmitter, which you could imagine has kind of an opposite effect if it's too high or too low. So GABA is a shortened acronym for gamma aminobutyric acid. Okay, it's actually an amino acid neurotransmitter, which means it's kind of a protein building block, curiously enough. So it's the one that calms down the brain signals and decreases brain activity. So you can imagine it being more relaxing for the body. However, if we've got too low of levels, we can start to see issues, including anxiety, right? If your inhibitor is too low, it means that we're on, the nervous system is on for longer, right? So anxiety, nervousness, insomnia. mental restlessness or feelings of dread, and even part of that might be panic attacks, right? So we're not turning off the brain signals quite as well as we should. With GABA imbalance, those low levels, like I said, can have an anxiety picture or insomnia. And high levels, we don't typically talk about, but that could potentially be an issue. It's really something we only see when we're over medicated on a prescription drug that gives us GABA. But common causes of the low levels is typically what we think of with GABA. And GABA deficiency can be due to all sorts of different things, including your own genetics, having a SNP or a polymorphic change in the DNA that leads to the GABA not binding quite as well. Stress is a huge one with GABA. So imagine you're on all the time, type A, trying to get all the tasks done, and maybe you're drinking a lot of caffeine at the same time. That is going to put us in the excitatory state more often and lead to chronically low GABA levels. Inadequate diet, it also is a cause of low GABA. And typically when I think of low GABA states, I think of also low protein states. Remember, GABA is an amino acid, which is a protein building block.
So these neurotransmitters are so important. Why don't we just test them? That's a pretty common question that we get. And unfortunately, because the testing that's available is urinary for neurotransmitters at this point, it's not something that we typically do in our practice. And the reason for that is it is really variable depending on what the person has eaten in the last 24 to 48 hours. It's oftentimes going to be very much affected by the amino acids that are coming in. It's looking at peripheral neurotransmitters, not what's available past the blood-brain barrier. So it's really only looking at a portion of the picture. So it would be really nice just to get a good, accurate level of what the heck are these neurotransmitters doing at a certain period of time in the body. But unfortunately, it's not something that we have found to be accurate at this point. So how do we evaluate? Once again, we want to empower you guys to understand these conditions and then how to address them. So from our standpoint, the first thing that needs to happen is taking a good look at your own symptoms or the person who's having the imbalances symptoms, thinking about what's going on physically for them, whether they're triggered in a current episode or looking at past episodes. Thinking about if there's anything biochemical that sounds like it could be influencing. And this could be biochemical internally, like with these neurotransmitters, or biochemical in regards to cravings for certain things, cravings for sugars, cravings for alcohols, that kind of thing. And then there's the emotional component as well. How are they feeling mental and emotionally, and how do they describe that? And what flavor, if you will, of anxiety or depression are they exhibiting? So we all have these direct signals that are coming from our body. Taking a moment to compile those and get a really good understanding of what your body is trying to tell you is first and foremost, because those clues are going to really be helpful for us in figuring out how to address. So different stressors, of course, are going to come into play here. So we want to take a moment to think about the physical stressors. Is there a trauma that happened physically, like slip or a fall or a broken bone or a recent surgery? Sometimes surgical events can trigger different depression and anxiety states post. Is there an issue with the physical lack of movement? Is there a physical lack of sleep? How about repetitive motions throughout the day, or even poor food quality that's physically impacting the body's ability to build these neurotransmitters? There's environmental impacts too. So taking a minute to think about, are there any chemicals that are coming in that could be disrupting our normal flow for these neurotransmitters, for example. And then thinking about, are there chemicals coming in that are disruptive from our personal care products, like our lotions and makeups, or even the things that we use to clean our house and laundry. And then there are EMFs. We know that they affect our mental emotional state, which is kind of wild to think about because they're all around us. And then artificial light as well, having a big impact. And we'll talk about that, how that in fact impacts our cortisol, for example. And then our water quality, of course, is going to also play into this. For physiologic reasons, of course, there's things like, or mental emotional reasons, there's things like toxic relationships, finances being a big stress for a lot of people right now, work, family, and then there's mindset. And with that, we're going to talk about that patterning when we were talking about neuroplasticity, that importance for patterning with our moods.
Right. So next we're going to talk about blood work and the ways in which we're assessing for biological causes of mood imbalances. So you can go to the next slide, please. So when we're doing blood work, some of our first go-tos for these conditions are going to be a complete blood count. So with a complete blood count, it largely allows us to look at underlying systemic causes of fatigue that may be contributing to either depression or anxiety. And this can allow us to look at anemia, infections, autoimmune conditions, allergic conditions, things of that nature. Our metabolic panel, through our metabolic panel, we're largely focusing on the fasting blood sugar, and we can also look at a hemoglobin A1C. And those are markers of our blood glucose levels. And that gives us a sense of whether or not diabetes can be contributing to long-term fatigue and depression, or if we're on a blood sugar roller coaster where we have high blood sugar that gives us lots of energy and then we're crashing, those can both be both high blood sugar and low blood sugar states can be causes of anxiety and depression and mood imbalances. We can also look at a hormone panel. So we're often using salivary hormone testing to look at estrogens, progesterones, and testosterone. And as I mentioned before, those can all contribute to anxiety and depression in different ways. We can look at a thyroid panel. So again, if hyperthyroidism, high thyroid hormone, or hypothyroidism, low thyroid hormone, is contributing to either anxiety from hyperthyroidism or fatigue and lack of motivation from hypothyroidism. And then we can look at cortisol and how our body is responding to stress throughout the day. And then lastly, we're often looking at iron and ferritin. So iron is the way that our red blood cells carry oxygen around our body, and that's particularly important for oxygenation to the brain. And ferritin is a marker of iron storage in the body. So we really like to look at that because it allows us to look at when iron is creeping down versus being, and we can see low ferritin before we're frankly anemic. And then we also like to look at B12 and folate, that the deficiencies in B12 and folate can lead to a different type of anemia that can cause fatigue. And B12 and folate are cofactors for a number of neurotransmitters, including serotonin and dopamine. So those are important for those pathways. So another thing that I just touched upon is the cortisol testing. So we like to do salivary cortisol testing, in which we look at cortisol levels at 4 different points throughout the day. And as we've discussed before, cortisol is that stress hormone, and we really like it to be high first thing in the morning when we wake up, and then to slowly decrease throughout the day to get us ready to be in a more relaxed state towards the end of the day. And that diurnal rhythm, or that daily normal rhythm of cortisol, is really important for that balanced energy. And so in looking at these cortisol levels, we can see if you have really low morning cortisol, that may be a sign of adrenal fatigue, and it's often associated when people have had long-term stress and are just feeling burnt out. So if you're waking up and just having a hard time getting out of bed in the morning, low cortisol may be contributing to that. Versus if we have really high evening cortisol, that's often associated with anxiety and insomnia. And that is, in that way, you can see a dysregulated cortisol response. So we really like to look at that and then correct that so that we can have that proper balance of cortisol from morning to evening.
Another way to evaluate mood, apart from these testing, these methods of testing, is the physical exam. Either when you're in office with a doctor, or just noticing what's going on with your body, your physiology at home. So one thing that I often see with some mood disorders, especially even sort of adrenal disorders and dysfunction, is that blood pressure fluctuations are common. If you can imagine that with it, typically what ends up happening is that that hypostatic blood pressure reading is the one that comes back most positive. So that's the one where you're laying down or sitting down for a while and you get up too quickly and sort of the blood drains to your internal organs. That's a hypostatic blood pressure. That's something that I commonly see with mood disorders of all different sorts. But usually they're ones where we're too excited, right? We're too stressed out, too type A, having a hard time truly relaxing. Another thing that I see is a pupil contraction test. Where actually, a doctor can shine a light into the eyes and notice, when the light goes into the eyes, the pupil will contract, okay? But when there's adrenal fatigue, that pupil starts to dilate and contract and doesn't stay nice and contracted. So that's just another pointer to there potentially being some adrenal dysfunction and maybe further mood dysfunction. So let's see. So some natural tips to enhance your mood and thrive, as we're sort of moving on to the next section here of our doc talk, where we'll talk through what we can do now that we've identified if there's a mood disorder. So just a recap slide here. Remember that your neurons need energy. Neurons are the nerve cells, and that energy comes from oxygen, right? Which your red blood cells and your iron bind in the body and bring that oxygen to the rest of the body. It comes from blood sugar, especially that glucose building block, and it comes from methyl donors that are energy for the mitochondria. Your neurons also need healthy neurotransmitters, which we talked about in the previous part of the talk. And they also need stimulation. If we're not using our brain, it sort of starts to deteriorate ultimately.
So we know you guys are really here to learn ways to support your mood. So we tried to break these up into 7 different zones that will make pretty significant impacts for a lot of people when it comes to mood. So the first one is sleep. And we've kind of gone over the physiology about why it's so important to have that melatonin to help build the serotonin, and why sleep can be so important for regulating our cortisol levels, and kind of just thinking about that idea that as cortisol, which is our stress hormone, goes up, our melatonin goes down. And so what does that do to our serotonin, our happy hormone? It goes down. And so how does that affect our mood? It goes down. So we know there's a very direct relationship with sleep. So it's one of the first places that we start as a foundational care piece for our patients. So we want to make sure that most adults are getting between the 7 to 9 hours a night. So making sure, of course, that you have proper sleep hygiene with a really relaxed atmosphere in your room, low in regards to electronics and lights. We want to make sure that we're on a schedule. This is more important than so much that we talk about. And it's one of the hardest recommendations that we give our patients a lot of time, is to make a routine. Just like toddlers need routines to nap, we need routines of bedtimes and wake times as adults too. Now, keeping that schedule in regards to food input is also very important in regards to sleep and cortisol management as well. And remember that cortisol, that stress hormone, directly impacts your neurotransmitters, which directly impacts your mood. So we also want to have really comfortable bedding and pillow. We don't want to have pain that's disrupting our sleep, and avoiding stimulants, of course. That can be hard in our society, especially if we're dealing with some fatigue or have a lot that we need to feel like we're accomplishing. That caffeine or stimulation, with even caffeine from chocolate, that kind of thing, after in the evening or noon, can be really problematic, as can alcohol in regards to getting that deep restorative sleep that's needed to produce that proper melatonin. So the next piece here is another foundational treatment, which is movement. And a lot of you have probably read in headlines or even read medical articles saying how important fitness and movement are for mood. We know that moving your body and exercising can reduce depression and anxiety to some degree. And we know that from the studies, when we compare them against our pharmaceutical options for anxiety in particular and depression, they can be even more powerful when done to a certain degree. So the studies that I've looked at most recently have shown that about 45 minutes of aerobic activity is as effective as some of our mood regulating pharmaceuticals for anxiety. So that's pretty powerful, but it's also a big ask for a lot of people to be doing that. We do have a very sedentary society in general. So anything you can be doing to get your daily movement in, even if it's just walking or stretching your body, is really important. So talk to your practitioner about that for sure. A lot of us were really trying to aim for 10,000 steps a day. It can be really nice to have fitness trackers to help us with that. It can make it fun to kind of track. Also, we like this idea of NEAT, the non-exercise activity thermogenesis. So that's doing things like engaging your core when you're seated, like parking a little bit further away to get a little extra walk in. So things that we don't consider necessarily direct, exercise, but are adding in more movement throughout the day, staying, in motion throughout the day. And then we really, of course, are thinking about more for fitness than, just heart health and strength and flexibility. We're also really thinking about how it affects the endorphin release and how that can deeply impact our mood. So please make sure you're getting your movement in.
We talked about sleep, we talked about movement. We are going to talk now here about breath work and breathing. Oftentimes we forget about this one. It's, we're so commonly thinking about what to eat, how much to sleep, how many minutes to move, but we forget how that 3 minutes without air is not conducive to life. We we sort of forget this huge piece to our existence, which is breathing. And so ultimately with breath work, it also takes some retraining, because if we're constantly inhaling, breathing into our shoulders, we're sort of breathing an anxious breath, right? So we could even try this in our chairs now, where if we breathe quickly into our shoulders, how we feel, right? Whereas if we breathe deeply into our belly and let our belly expand in these diaphragmatic type breaths, we are actually calming down, and the nervous system is less stressed with that type of breathing. If you want to know more the specifics of all of this, there's a really good book called The Oxygen Advantage. It's that third bullet point down, where it talks through which breaths are the best breaths ultimately for all sorts of things, your optimal health, but also for regulating mood. Bigger breaths does not mean better. Actually, if we are exhaling for longer than the inhale, that we can sort of label as the better breath. We're sort of releasing tension rather than keeping it in. Nitric oxide gets mentioned here because it's a vasodilator molecule, which means that it dilates the blood vessels. And it does so just through inspiration, through breathing in. So the deeper we breathe in, the more vasodilated we can be, the better our circulation. And that last bullet point there talks about alternate nostril breathing, which is a traditional Ayurvedic breath where we're sort of we're breathing in from one side of the body, breathing out through the other side. And it's something that really helps balance our nervous system.
So speaking of nervous system, we also have the ability to really think about just calming and de-stressing the nervous system as we do things like practicing mindfulness. So taking time to have calming, meditative time essentially can be very, very helpful for rebalancing our nervous system. When we control our norepinephrine, our epinephrine, our catecholamines, the stimulatory neurotransmitters that make us more anxious, it can be very, very helpful for balancing anxiety, but also can be helpful for balancing depression. So anytime that you can carve out, it could be 10 minutes while you're in bed, even to take that time and recenter yourself, thinking about things that you are thankful for, or also just doing more meditative, clearing your mind time can be really very helpful. So we also, if we can, want to access nature. We know that there's a direct feedback with reconnection with nature for us humans. And we also want to really help support something called our vagus nerve. And that's our cranial nerve 10. And this is one of the most important nerves that helps regulate the parasympathetic nervous system. And so that's the calming down, the rest and digest, finding stability portion of our nervous system. We also have a little note here that chiropractic care and massage both actually can be really helpful for restoring our parasympathetic nervous system and tapping into that calm state. So the role of the cranial nerve 10 really is to supply that parasympathetic nervous system, that rest and digest system, with information. And this is wired into multiple organs of our body and really helps everything from our digestive control to our breathing. And it is a very important one for digestion too, which once again, remember that brain that second brain is right in our gut. So we really want to be supporting that digestive system in order to find balance with our nervous system. So simple ways that you can be supporting your vagus nerve are things like humming and chanting and singing. And I love this because it's something that we find in a lot of traditional communities, is that that is part of their celebration and part of their cultural experience. And that really can help with our nervous systems. Of course, we want to identify things that are stressing us and try to reduce those, really controlling those stressors. We want to be focusing on our digestion, thinking about our gut, because once again, that's so looped into that vagus nerve. We know that things like gargling and activating our gag reflex can also stimulate that cranial nerve 10, as well as exercise. And we also know that breathing, affecting our breathing, that deep belly breath, can also directly stimulate that cranial nerve 10 to help us find our balance, our calm. Cold exposure can as well. So a simple thing we'll do with a lot of our clients is have them in their showers in a cool spray, or directly spray in the shower over their throat and upper chest to help stimulate that cranial nerve 10. And then acupuncture is something that we use as well in our clinic that Dr. Mary specializes in. And we know that that has a direct stimulation in regards to the balancing of the vagus nerve. So now we're going to talk about food, everybody's favorite subject, or at least mine.
All right. So when it comes to food choices for supporting our neurotransmitters, for supporting our mood, we want to look at a couple of major categories of foods. So foods high in B vitamins, foods high in calcium and magnesium, high protein foods, and then healthy fats and omega-3 fatty acids. So B vitamins contain some of our major methyl donors, and they're also involved in the production of neurotransmitters. So those are kind of some important building blocks for our nervous system to function properly. They also are going to help provide energy for our neurons and help regulate cortisol. So some of the foods high in B vitamins include salmon, leafy greens, liver and other organ meats, eggs, beef, oysters, clams, and mussels, legumes, things of that nature. Then we've got foods high in calcium and magnesium. Calcium and magnesium are particularly good for regulating anxiety. So those are great foods to incorporate in your evening meal or before bedtime snack. And then high protein foods, these are going to contain the amino acids that are the building blocks for our neurotransmitters. And they also help regulate our blood sugar. And that we'll discuss in the next slide, but the blood sugar regulation plays a huge role in our mood. And then lastly, we've got healthy fats and omega-3 fatty acids. So omega-3 fatty acids are a type of fatty acid that we can store in our cells. And then when we go to have an inflammatory response, we are able to use those particular fatty acids and cause a less inflammatory state than when we have other types of fatty acids stored in our cells. So these allow us to decrease inflammation in the brain, which can really help with mood regulation as well. So next we'll talk about blood sugar regulation. So our brain uses 20% of the body's glucose, and it is blood sugar or glucose is the main fuel that is accessible to our neurons and the cells of the brain. So when we have dysglycemia or blood sugar dysregulation, and we're on a blood sugar roller coaster, so you have a bolus dose of a high amount of glucose, or high, easily absorbable sugars, that spikes your blood glucose, and your brain uses up all of that energy. And then that also sends your insulin really high, and then you're going to have a crash in your blood glucose level. That means that your brain also has a lot less energy. So if you ever notice that you have a high carb meal and then a few hours later you crash and are having a hard time with cognition, that is that blood sugar roller coaster. And as you can imagine, it puts our brain on a roller coaster as well. So some ways to address hypoglycemia and hyperglycemia, or low blood sugar and high blood sugar, are to try to decrease those fluctuations of glucose between meals. So eating breakfast can be really helpful with that, and including proteins and healthy fats in that breakfast are going to slow the release of sugars and other forms of energy into your bloodstream from your digestive tract. Also, eating low glycemic snacks between meals can be really helpful in regulating that blood sugar. And if you tend towards having high blood sugar or hyperglycemia, we want to really regulate that carbohydrate intake. So really focusing on low glycemic foods, and focusing on getting protein in every meal, and particularly when you are having a carbohydrate rich meal, pairing it with protein and fats. Chromium is also a nutrient that has been shown to support the import of glucose into cells and to lower blood sugar, yeah, allow us to use the the sugar from our blood in our cells. And so that's one nutrient that we're often including in treatment plans for hyperglycemia.
So I love touching on this dietary piece. It's a topic that always comes up in our doc talks, because honestly, food is medicine, right? And the way we are nourishing our bodies has far-reaching effects. So these next two slides are just kind of like your cheat sheet to which foods to include for mood and which foods to exclude. So generally, we're thinking anti-inflammatory foods, including our healthy fats, because our brain is mostly fat tissue. Our plant-based antioxidants, so our rainbow of colors is going to, a rainbow of color in the diet is going to mean that we've got a diet high in antioxidants. And then obviously a healthy amount of glucose, that building block, sugar building block, but hopefully one that is low glycemic, which means it's part of our root vegetables, part of our fiber-rich carbohydrates that allows us to prevent having blood sugar spikes and dips throughout the day. And foods to exclude are our inflammagens, right? Our exogenous stimulants and depressants. So think of alcohol, think of processed food, think of our high glycemic meals. Basically, you know the drill. This is a common. It's very common that in general, when we're talking about optimal health, including optimal mood, that we're pulling away the inflammatory components and adding in a wealth of anti-inflammatory foods.
So we want to give you guys some specific foods that can help build these neurotransmitters. So we're going to go back to our serotonin, our dopamine, and our GABA, because those are kind of the main three we want you guys to walk away with as understanding. So your happy hormone here, serotonin, is built with tryptophan, which is an amino acid. It's a protein. And you guys may have heard that tryptophan is rich in things like turkey, which is coming up perfect for this month, right? So tryptophan makes us feel satiated and kind of sedated and happy. So it is something, yes, that is in turkey. We also can find it in some other poultry like chicken. We see it in some fish like halibut. It's found in liver, it's found in lamb. We can find it in mushrooms. We can find it in spinach and salmon, shrimp and soy. So those are tryptophan-rich foods. So if you're concerned that your serotonin levels are depressed, including those in your well-balanced diet can be helpful.
Okay, so the next one is our foods for building dopamine. So there's some really fun ones on here. Chocolate, namely, is one that is known to be a source of phenylalanine and tyrosine and help build dopamine levels. We also see some meats like beef and pork and turkey, some oats here, eggs and fish. So really just moderate intake of beef and dairy and eggs should be sufficient to support your dopamine levels. And, when you're feeling really grumpy, chocolate, again, in moderation is a great way to support yourself in that way as well.
And lastly, we've got our GABA building foods, which are typically rich in glutamate. But this one's a bit tricky because you don't want to boost glutamate too much, which is why MSG gets a bad rap, because glutamate can actually be excitatory, right? We ultimately want glutamate to turn into GABA, which is our inhibitory neurotransmitter. So unless, your diet is only these sorts of foods, usually it's not so much of an issue.
So let's talk supplements now that we've kind of gone over the most important food piece. We know that we can influence mood with different supplements. So we like to kind of break these into our vitamins and minerals and then our herbal medicine, our botanicals. We know that we're going to want to look at the building blocks for our neurotransmitters. So we're going to go through those with you today, and we're going to, have this available. This PowerPoint will be available on our website later for your reference as well. So don't feel like you have to memorize it all. But we know that certain nutrients, certain like B vitamins, for example, are going to help with building of certain neurotransmitters. And those are chemical, our chemical signalers. And then we also have that ability to support our adrenal system, our cortisol regulation system that deeply impacts our melatonin with some of these as well. So in our apothecary here at Prosper, we try to keep a lot of these things stocked, and we're usually making these recommendations on an individualized basis, depending on what is going on with an individual's specific mood dysregulation. We like the idea of adrenal support for a lot of our patients who are dealing with stress impacting their mood imbalance. So if cortisol is implicated, sleep is imbalanced, these kind of things, we're thinking a lot of times along that adrenal support pathway. So we want to be thinking about our B complex. We want to be thinking about our vitamin C, our magnesium, our omega-3s, those fish oils for our brain health, and we want to be thinking about adaptogenic herbs. So common adaptogenic herbs are things like holy basil, ashwagandha, rhodiola, panax ginseng, those kind of things. So we absolutely love those. As far as our methyl donors go, we had kind of mentioned these methyl donors being like our B12 and our folate and how important those are for energy production. Remember, we got to go back to this understanding of how does the brain even function in the first place? It needs our oxygen, it needs our sugar, it needs that glucose, and it's going to need those methyl donors to do its job of producing that energy, that ATP. So we need folic acid on board, and we're getting that through our leafy greens. We can also supplement with it in the form of 5-MTHF being our personal favorite here in our office. And there's really fabulous research studies that have been done on this for both anxiety and depression. B12 is another big one that's a methyl donor, B6 and betaine. So that trimethylglycine, also methyl donors that we'll supplement sometimes with. And then our EFAs, our essential fatty acids. So remember, they're modulating inflammation and they're food for our brain. So we think about that image of a fatty brain, that's real, and we like that brain fat. So we want that fish oil and specifically DHA form of omega-3 for the brain food. Now, we wanted to make sure we went through these neurotransmitter pathways with you guys today. So once again, you'll find that we're pretty scientifically based, and we want to understand how we're impacting our patients in regards to their mood, especially. So the first thing we see here is this amino acid, this tryptophan. Now, tryptophan requires iron to then transfer into 5-HTP. Many of you have probably heard of 5-HTP. Maybe you've even taken it for things like depression. 5-HTP is one chemical step away from our serotonin. And it is something that we need, that iron, in order to transform that tryptophan that we ate our turkey and got our turkey. We need the iron that's also in that turkey, for example, to convert and make that 5-HTP. Now, 5-HTP also is going to affect that melatonin synthesis, so our sleep. So we talked about that as well. But if we have a client coming in who has anemia, for example, I see this in a lot of women who are still cycling and having their menses, and they tell me they have depression or even mixed form of depression and anxiety. If they're anemic, it is very difficult to properly address their depression. Even if we're using pharmaceuticals in order to do that, we need to fulfill that iron imbalance before we can correct a lot of times this mood disorder. So always wanting to make sure we know what the iron levels are and then supplementing with iron if it's appropriate. 5-HTP is something that can be supplemented with directly, and it's typically given at bedtime because it's going to help with that melatonin building. We know that St. John's wort works directly on the serotonin release and flooding into the neural synapse, that area. So it works kind of like an SSRI does. And that's an herb that's very well studied for the management of depression and helping with that serotonin level. We know that SAMe is another one that directly affects serotonin synthesis. And then we have these cofactors. So you can see them in that little blue box there, that B6, the B3, the B12, magnesium, and folate being really critical for the production of serotonin and for that conversion of 5-HTP to serotonin.
Okay, so next we're going to talk about dopamine pathways and how we can support those. So first up on our list is Mucuna pruriens, or velvet bean. So this is a type of adaptogen, comes from Ayurvedic medicine, that is known to regulate hormones, and specifically it contains high levels of naturally occurring L-DOPA, which is a precursor to dopamine. So that's a great one to include. We also have beta-phenylethylamine, or PEA, which is an amine, or it's a type of molecule induced in that's produced in our bodies that promotes those dopamine pathways. We've got blueberry extract, or anthocyanins. So those you can either get from tinctures or specifically created extracts like syrups of blueberries, or you can just increase the amounts of blueberries and blueberry-like fruits in your diet. And blueberries have been shown to improve the survival of dopaminergic neurons, or dopamine-producing neurons in the brain. We also have phenylalanine and tyrosine, which are the primary precursors of dopamine. So they're what you start with when you're synthesizing a dopamine molecule. And those can be really helpful in supplement form. And then we've got cofactors, so B6, iron, and THB and BH4. These need folate to function. And so all of these combined together is a great package that allows these, they're basically helpers in an enzymatic reaction to help produce dopamine along its synthesis pathway.
And lastly, we end with our GABA pathway, which remember is our inhibitory neurotransmitter. So we think on this list are the herbs and supplements that sort of help us relax, help us fall asleep. So when you think of your sleepy time tea, you probably got some valerian and passion flower in there. Ones that specifically are highly studied for kind of pushing the GABA system are the L-theanine, the kava kava, as well as the valerian. I've seen really good studies on those specifically helping with calming down that nervous system ultimately. Also on this list is lithium orotate, that is not the prescription kind, which helps stabilize mood, as well as L-theanine, which is a really big one for our anxiety patients. I've seen this one work so well. And then lastly, at the bottom there is glutamine, which can be taken as a powder that not only helps the gut, but also helps the mood.
So our last tip here is to really hack into your headspace. And I know that sounds silly, but essentially it's our perception itself, and helping with that neuroplasticity, and that sometimes we have to practice being in a more positive mood. So keeping a gratitude journal, there's lots of research studying that, saying that makes a huge difference. Making sure that you have time to really connect back in with nature. And then if you are somebody who is fueled by social relationships, making sure that you're getting that social input and exporting as well. And then making sure that you're tapping into meditation and or prayer as a portion of your brain health strategy. And then thinking about your life work, your purpose, how you're tapping in to feeling useful in this life. And then there's another tip here called EFT that a lot of you may know about. It's the emotional freedom technique. And there's lots of videos on this online that are free. And it's essentially a series of tapping that you do to your body to help kind of clear your mental space and reset. And to me, it's a form of moving meditation, essentially. So these practicing that positivity and that thankfulness and that gratitude can make a huge difference. We do have a program online to help people with stress who are dealing with stress. It's kind of a DIY program. So it's something that you can choose to either work with us docs and have us oversee the process, or just download all the information yourself and get going on it. And it has a health tracker on it with your goals. It helps track your nutrition and your movement and your water intake and things like that. So it can be really helpful for some people who are just feeling completely overwhelmed with stress and feeling like stress is impacting their mood. So now we're going to talk about the Chinese medicine component and then the Ayurvedic component.
Okay, so in traditional Chinese medicine, we have this syndrome called Yu syndrome, which translates to stagnation, not flowing, entangled, or clogged. And in traditional Chinese medicine, we have 5 major organs, and they are connected through the body, through the acupuncture meridians. And the free flow of blood and qi are essential for all of those organs to function. And each of those organs has an emotional component. So when there's a impediment to that free flow of blood and qi, we can have emotional symptoms arise that can vary person to person depending on where the U syndrome is occurring. So some of the common patterns we see are liver qi stagnation, phlegm dampness, qi deficiency, and heart blood or yin deficiency. So this all probably sounds like a completely different language to you, but essentially what is important to recognize here is that we all come with our own history and patterns that affect us both physically and mentally. So for instance, with liver qi stagnation, this is often presents as mixed anxiety and depression. The liver is responsible for creativity and our ability to make plans and follow through with them. And so liver qi stagnation often presents as, so when this aspect of ourselves is not functioning properly, we often experience anxiety, depression, irritability, and apathy, and a propensity for anger. And we also can see a pattern known as phlegm dampness, where people feel like they're walking through water, their mentation slows and their speech gets difficult, and they just have a hard time kind of getting out of bed and moving through the day. We can also have qi deficiency, where we see a fatigue and lack of motivation. And then heart blood or yin deficiency is a particular type of mood disorder, which we often associate with anxiety. And this is happening because the heart houses the shen, which is the mind. And in Chinese medicine, the mind needs to be grounded in the heart. And one of the ways it does that is by us having the proper nutritional, nourishing substances to ground that shen. And when we're lacking those, it becomes ungrounded and can lead to feeling anxious, feeling ungrounded, and having insomnia. So we address each of those patterns in different ways. And I'll give you an example of how we address liver qi stagnation. So as its name implies, we're mainly dealing with stagnation, so we need to promote the free flow of blood and qi, and that is the role of the liver, to promote the free flow of blood and qi and allow that to circulate throughout the different organs. So one of the most popular or well-known and historically used formulas for anxiety and depression is called Xiao San, and this is translated to rambling powder or free and easy wanderer is another name for it. And this formula soothes the liver, it spreads liver qi, it strengthens the spleen, which is responsible for our digestion and allows us to get the most out of our food, and it tonifies blood by strengthening the spleen. So this particular formula has been well studied for use in depression, and it's one that I recommend all the time because it can be really helpful for just that stuck, irritable feeling. I also love to use diet and lifestyle strategies for supporting the free flow of qi, and particularly with liver qi stagnation. So movement is excellent for that, getting out and moving your body in any way that is enjoyable. And then qi moving herbs and spices tend to be aromatic herbs and spices. So think cardamom, cinnamon, warming, moving foods. You can also make a tea with orange peel and rose, and incorporate warming aromatic herbs into a tea as well. And then, so lastly, we've got acupuncture, which is one of the main tools for relieving stagnation. One of the effects that has been studied with acupuncture is that it releases endorphins. So those are those happy, euphoric neurotransmitters and hormones that are released when you exercise, when you get intensive exercise, and that can happen when you're just on the table getting acupuncture. And specifically with auricular acupuncture, I really like to use this when there's an anxiety component to either a pain condition or any physiologic condition. And this is because we can access the peripheral branch of the vagus nerve through the ear. And so that involves sticking needles in the center of the ear here. And it has been shown to be really effective for supporting people through anxiety and depression.
Thanks so much, Dr. Mary, for that perspective. So in addition to naturopathic medicine, Dr. Mary also practices extensively traditional Chinese medicine and acupuncture, which is just so amazing. Here we've got sort of the Ayurvedic perspective, which is another Eastern healing modality and a specialty that I bring into the practice. And Ayurveda is a traditional medicine from India, and it's Sanskrit for the science of life. And ultimately, it's a whole set of very vast rules that have to do with your own energetic balance and imbalance. So on the bottom here is a graphic with the 3 different doshas, or the mind-body types, that are made up of different elements. And someone who is in balance finds themselves in the center of that Venn diagram. Someone out of balance finds themselves in the periphery. Okay, so in terms of mood imbalances, anxiety, we think of high vata, which is our air and space element, right? You can imagine it's just too much going on, the energy is rising into the head, and the vata is high. With depression, it's the opposite. It's high kapha, which is our earth and water elements, our very grounded dosha. If you've got too much grounding, it's hard to get up and get motivated, which is often what we see with anxiety and depression. The general treatment for both of these involves pulling from the other sides of that Venn diagram. Our favorite modalities for in Ayurveda include herbal medicine, diet, and then lifestyle as well. So for anxiety, ashwagandha is the heavy hitter. And it depends on who you ask, which Ayurvedic practitioner, whether you start with 500 milligrams or 15 grams, okay? It really depends on the practitioner. But I have seen ashwagandha work really well. It usually takes about 2 weeks to work, and generally we sort of build up the dose. In Ayurvedic medicine, the way we get to those high doses is ultimately by mixing the powder in water and chugging it down, which is not typically what we end up doing here in the Western world. For depression, think about our heating herbs. So cayenne is a really big one. It's something that you can encapsulate and definitely take with meals, not if you have a stomach ulcer, right? And we gently work up that heat over time to a point where it sort of heats up the kapha, melts away that earth and water element that's very stagnant. In terms of diet, ultimately for anxiety, we've got to calm the air element. So think warm, soupy, root veggie stews. For depression, it's the opposite. We've got to heat up the metabolism, not just in the GI tract, but also in the brain. So think about adding a lot of spices to meals so that they're not bland. And then lastly, for the lifestyle piece, routine is huge. And I know Dr. Molly also touched upon this. Routine helps the body know what to expect and ultimately not get surprised and anxious. Another thing in Ayurveda is we've got to treat constipation, right? So when we think about the dry pathology that is anxiety, it means the rest of the body is often also dry. Okay, so that's a big piece that we only really see in these Eastern medical modalities, how your GI tract can really be related to your mind so intricately. We've got to warm up the anxious person with layers, as well as oil massage, cover them with the earth and water elements to kind of ground them. And again, that pranayama, that breath work, that alternate nostril breathing is going to be key for our anxious patients. For depression, it's a little bit opposite. So again, we've got to heat up the body to motivate it. And often that includes exercise, getting up and just doing it, getting a habit going. Less sleep is also important for the depressed person so that we're not sleeping through the hard times, that we're actually having to address them. And lastly, that breath work, the Kapalabhati breath that I note here, you can type into YouTube and see some good videos, but it's a heating breath essentially for heating up the metabolism of both the GI tract and the brain.
Thank you guys for that. I've just loved learning more about these Eastern modalities and incorporating them into the naturopathic care here at Prosper. So we want to take a moment and just invite any of you who might have questions to type it into the chat. We also want to invite you to our Doc Talk, which will happen on the second Tuesday of next month, December 14th, and it's going to be all about fatigue. So we really want to get into the nitty-gritty of what can cause it and how to address it, because it can really affect lives. So if you guys have any questions, we invite you to type those in now. Otherwise, if you have any concerns or want to talk to us individually, we're of course here for that. You can give us a call to get scheduled, or you can jump on our website and request an appointment that way. Let's see. It looks like, oh, I've got a question about the stress app information. Let me go back to that. So that is found on our website, or you can type this URL in directly. And basically, if you go to our website, prospernaturalhealth.com, you can go under our programs, and then we've got 4 listed. So there's one there specifically for stress. And it looks like Dr. Rosalie just shared that with us too. So thank you guys so much for joining. We so appreciate your time and we love doing these. So thank you. We'll see you next month.